The people, places, and events pictured in this presentation are all fictional and were created by the author. Any resemblance to real people is purely coincidental. However, the information provided is an accurate description of the course load and requirements to receive a medical license.
Hello, can you please introduce yourself and tell me your credentials?
My name is Phineas Shark, medical doctor. I work as a board-certified geriatrician at Atlantis United Hospital.
What major were you required to take in college?
In my medical program, there was no required major, but biology and chemistry were strongly recommended. Also, you had to have completed a 4-year degree before you could be accepted into a medical school program.
What are some classes you were required to take?
So in addition to all of my undergraduate university's core curriculum requirements, I was required to take 3 years of additional classes. Examples of some of these required classes are 2 semesters of biochemistry, calculus, organic chemistry, chemistry, comparative anatomy, and microbiology.
What are some requirements you had to have in order to get into medical school?
All students applying to medical programs have to take the medical college admissions test to be considered. As with any test, the higher the score, the more favorable your options for programs are. Students must also have maintained a grade point average of 2.0 or higher to be accepted into a reputable medical program.
Did you need any additional training or certification after medical school?
So I was required to complete 3 years of residency at the university hospital. However, surgeons do an additional 2 years, and most specialties require an additional year. I also completed fellowship for a year after my residency, and some doctors complete up to 3. As far as licensing goes, I took my United States Medical Licensing Exam Part 1 in my sophomore year. And I took the second part during my senior year to receive my medical practice license and board certification.
After you completed your training, did you have a clear plan on what you wanted to do? Did you prefer private practice or working for a hospital?
After college, I was leaning towards private practice, but considered my options before making a decision. The benefits of working for a company is you immediately can have job placement, stable, steady income, health benefits, and an established client base. However, some drawbacks may include inconvenient shifts, varying levels of competency around nurses and other coworkers, limited individual control of environment, equipment restrictions due to budget, treatment restrictions according to facility policy, and the potential for a hostile workplace. In comparison, operating your own practice will be expensive on startup, however. You can enter into a partnership with an existing reputable physician or acquire investors, as well as working part-time at a local hospital to boost your income. Some benefits include having the ability to hire well-trained specialized staff, managing your brand and control over treatment plans, equipment, and facilities, as well as determining costs for your services and setting your own schedule. Some challenges may include marketing, establishing a clientele, ensuring a clean, friendly work atmosphere, maintaining educated, well-trained staff, picking benefit staff plans, setting salaries, establishing good relationships with insurance and medication companies, making sure patients are receiving quality care by evaluating them and developing customized treatment plans.
Wow, that was very informative. Now, tell me, what kind of salaries do doctors make?
The salary of doctors varies, but typically the average doctor makes $125,000 a year or higher after residency. But depending on their specialty and whether they are private practice or not, many doctors can make $350,000 a year or more.
What are your favorite things about your job?
To me, the best part about being a doctor is interacting with my clients in a way that can benefit or even turn the trajectory of their life around. The ability to learn about my patients' issues and investigate and try to solve those issues gives me a great feeling of accomplishment. It is comparable to a detective, except I have the opportunity to save people by finding out what caused their issues before it becomes too late, and maybe grant them some comfort in the process.
What inspired you to pursue a career as a geriatric doctor?
I became a geriatric doctor because my parents were older and 3 of my grandparents passed because they did not receive adequate care. For my maternal grandfather, urgent care doctors misdiagnosed his fractured pelvis. This led to him requiring rehabilitation at a nursing home, where he got COVID and passed away at 94 years old at my paternal grandfather was diagnosed with Alzheimer's at 68 years old, but treatment was not yet available at that time, and the area had a lack of geriatric care and treatment facilities. He passed 4 years later after suffering a stroke and a urinary tract infection. As my grandmother, his wife, aged, we struggled to get her to seek out treatment for her conditions, which included osteoporosis, bursitis, chronic sty, vision, and hearing loss. Caring for her is what inspired me to pursue geriatric medicine as a profession so that I may be able to help care for my own aging parents, people who helped raise me, and the growing elderly population as a whole, which is projected to be over a third of the population within 20 years.
Thank you for your time. Do you have any advice you would like to give the general public?
My advice to listeners is to love yourself. Try to eat a balanced diet. Don't drink or smoke, and if you do, take steps to address it if you can't do it in moderation. It is important to exercise routinely. Spend time outside. Also pay attention to your mental health. Hold yourself accountable. Reward yourself. Forgive yourself. Try to establish healthy habits. Coping mechanisms in relationships. A well-adjusted individual is overall healthier and has less health issues.
Well, that answers all my questions. Thank you for coming in today, Dr. Shark, and thank you to all my viewers.
Hello. To make this video, I used information from my dad, the internet, and other medical professionals, and I compiled them into a list and then made a script kind of based on that kind of interview style. Just wanted to do something a little different. To do that, I used an animation software on Adobe Express, and then I used the Speechify app with the voice of Cliff Weitzman to use the AI to generate the voice because I get a little nervous when I'm trying to speak. And my friend Harley Rebold also helped me with the female voice aspect of it. I appreciate your time, thank you for watching, and I hope you have a great day.